he's the lead health official at the Prince George's County Health Department, and he's going to be answering some of your questions about the virus and how we can, as you young people can stay healthy and keep others safe as well. But Dr. Carter, I will say that all of my kids have been responsible because all of them have already been tested and vaccinated. So,
oh, that's great. That's great. That's great.
So I don't want you to feel like you preaching to the choir here, but you know, they could serve as ambassadors for you.
Oh, absolutely. Absolutely. They certainly can. So I appreciate having the opportunity to talk to all the young people. And I want to answer the question so that when somebody asks them a question, they can answer it. No, this is great. And I really appreciate you having me.
Thank you. Thank you. Thank you. All right. So we know the doctor's time is limited. We want to also thank George Ernest for he's the contact person with Dr. Carter for actually being showing his due diligence and working with me and communicating. You know, and you gotta love people like that that want to make things happen. So George, throw all roses to you, man.
Thank you, sir. It's well worth it.
Yes, sir. Yes, sir. All right. So Gervais, what question you have for Dr. Carter?
Okay, my question is, how will these vaccines protect me and my family and my friends from getting sick from COVID?
Well, let me tell you about a vaccine. The vaccines help your body's immune system to work faster than it normally does and better. And that's important for you to know because your immune system is your body's system for fighting off infections. It fights off infections every second of the day. Your immune system is doing that. So what vaccines do is basically allows your immune system to recognize the virus. And then that information, once it recognizes the virus, that information goes on to create these molecules called antibodies that help activate your killer cells in your immune system, which ultimately is the weapon that your body uses to fight the virus. And that immune system, once it's activated to fight the virus, protects you. When you get exposed, the virus then gets killed almost immediately. And then it protects you in the future. So that's the way vaccines work. And that's how it protects you and your family, because you then, once you can kill the virus off, then you don't spread it quite as much.
Great question, Gervais. First, I want to make sure before we move forward with each of our youth, let everybody know, like, you know, your background, school affiliations, and the fact that you are a county resident. So, Gervais, just let everybody know, you know, what school you're affiliated with, and what district you're from.
Okay, my name is Gervais Dumas, and I go to PGCC. I'm a human services major. What was the other thing?
What district you live in? I mean, some I know people don't know what district they live in, but if you do know.
I don't.
Well, I don't either.
Who's your council member, Gervais?
I can't answer that question either.
Yeah, y'all gotta get to know that. Y'all have to know your council. Okay, Robert, go ahead.
My name is Robert Neal. I'm 20 years old. I'm a recent graduate from Prince George's County Community College. I was a cybersecurity major, and I live in Prince George's County. I live in Upper Marlboro, like right across the street from Wise. I have no clue what district I'm in or my councilman. Okay, so y'all probably can tell me based off that.
Right, go ahead. What's your question?
My question was, how will me and my friends getting vaccinated help in the pandemic?
Thanks for that question, Robert. You know, the more people who get vaccinated, the harder it is for the virus to spread. Viruses constantly need a host, a person to replicate itself, to keep so that it can spread, and that's the way it survives. So if more people get vaccinated, then the less likely it is for the virus to keep on spreading. It just can't do it. And that's because the viruses help. The vaccines will, the viruses love to spread. And if you're vaccinated, the vaccine stops it from spreading. It stops it from growing. It defeats the virus. And it makes it very, very hard for it to get out of your body into somebody else's body if you're vaccinated, because your immune system just got through killing it. The world has gotten rid of so many infectious diseases over time because of vaccinations. I know you know that before you went to school, you had to get your shots. Those are vaccinations that protect you against all sorts of really not good diseases, but it does protect you. If you notice, a lot of folks you don't hear about these hideous diseases of people dying from it because you got the shots when you were a kid going to school. So that's the way vaccines work. They protect you. They help your body fight off an infection, helps it from spreading to other people, and protect you for a long period of time.
Thank you.
Okay, Nigel?
I go to Towson. I'm a nursing major. I don't know what district I live in, or my council member. How long have coronaviruses been studied, and how did that prior research help develop the vaccines quickly?
Coronavirus family has been studied for many, many years. Scientists have already got a pretty good idea about how that virus is going to work even before the pandemic started. And that's because these viruses, these coronavirus family, this isn't the first type of coronavirus that's ever been around. This just happens to be a new one, a new family member. So for this Corona-19, which was founded in 2019 in China, they already were really on the case, basically making sure that they knew how this virus looked, how it worked, what its structure was. And all that came about fairly quickly. In early January 2020, the scientists were already mapping out the gene for the virus. And that just tells you that gene tells you how the virus makes itself. They already had that already mapped out. So they knew how the virus is going, that virus would behave. And that's good news, because then you can get to the next phase of creating a vaccine once you know how a virus works. So that helped science to develop that vaccine and ultimately get to the point where we are now, where this vaccine can be so effective because we were already on top of it in terms of the science.
Okay, great. Nendam?
My name is Nindam, and I'm from District 4.
What?
And I currently
She knows, huh? Go ahead.
And I currently go to PDCC, and I'm 18. And my question is, what was the process the FDA went through to determine that the vaccines are safe for humans?
That's a really good question. Let me tell you a little bit about the FDA first. See, the FDA is one of the most respected institutions in the country, but in the world. And what they do is they set scientific standards for all sorts of things in medicine, but in particular, they do it for vaccine safety, vaccine effectiveness, and vaccine quality. So you can't just have anybody come and make a vaccine and put it on the market. The FDA has to approve it. And they have committees of some of the most world-renowned scientists make sure that these vaccines are working like the manufacturer said it's going to work, and making sure that that vaccine is safe. That's their job. That's the FDA's job. So the FDA, what they do is they bring these scientists together. They take a look at what these vaccine developers have done, and then they make these vaccine developers go through rigid tests to give them information back so that they can make the decisions about whether or not these vaccines are safe. So those manufacturers have to go through these clinical trials, because once the vaccine is made, you can't say, oh my God, it's safe. You have to make it, first you have to test it in animals to say, will it kill the animal? Does it hurt the animal? Then it's no. Okay, well, what are we going to do next? Well, the next thing is to do what they call a phase 1 clinical trial. They go find out a few really healthy people and say, okay, we're going to try it in you guys. And you guys, we want to see if this is going to work. Now, those people who go into phase 1 clinical trials, they're very brave people. because they really don't know what the vaccine, what will happen to them. But in this case with this vaccine, they knew that the animals didn't react so bad. They didn't react at all. It was greater in the animal models. So they said, okay, we'll do phase 1. They did phase 1 and everything worked out really well. So they went to what they call phase 2 clinical trials. And then in that clinical trials, those folks are not as, those are just regular people. They could be healthy. They may not be healthy. Some of them are really have very significant disease, but they tested against across the board. And they just say, okay, we're going to test it to see, but it's not as many people as for what I'm going to talk about in the next phase, but it's still a group of people. And these are across all demographic groups. And they compare vaccinating those people against another group of people who don't get the vaccine and see how well it does. And then the next, if that goes fine, then they go to what they call phase 3. In phase 3, they have to find a lot of people, thousands and thousands of people all over the world, all walks of life. And then they have to do that trial. And then if that turns out okay, if then they can say from that data how efficient the vaccine was and how safe it is. Because it could be safe, it could be efficient, meaning that it fought off the virus, but it could cause a whole bunch of side effects. But these particular vaccines went through those clinical trials. No shortcuts were taken there. So that's when the FDA said, we're going to approve this for emergency use because we know right now the data says it's safe and efficient. Now there's some other paperwork steps you have to go through to get to full approval. But if you can get to emergency use, you know that you can start using it to protect people. And that's what the FDA did in this case.
Okay, thank you.
You're welcome.
Hi, my name is Victoria Watley, and I'm 21 years old. I go to the University of Maryland, and I'm a communications major. My district is like Nindum's, District 4. My council member, I don't want to butcher his name, but I'm pretty sure his name's Michael Steve. I don't want to get that wrong, but that's his name. But the question I have for you is, in December of 2020, you were one of the first health officials to get the vaccination shot. Why did you want to do that publicly?
Thank you, Victoria. And you're the communications major, Victoria. So I want you to get this out for me. I want people to know this, especially young people.
Mm-hmm.
I'm the health officer in Prince George's County. I'm sort of like the county's doctor. And I have to be able to show to each and every resident, whether or not like a vaccine or anything that comes into our community, I have to show whether or not I believe it's safe and I believe it'll be effective. And because if I didn't believe it was going to be safe and effective, I wouldn't have gone on TV and I wouldn't have gone public, and I would have been giving out a whole lot of warnings because my job is to protect everybody as best I can. So I went public because I wanted everybody to see that I'm a doctor. I've been practicing medicine. I'm a pediatrician for 40 years. I want them to see that I will take that shot. I know that it's safe. I know that it's effective. I wanted to have all of my family come on because everybody in my family, my wife, my children, my wife's older parents, my brother, all their children, everybody. And then they got vaccinated because I am one of the leaders. And if I don't take it and show that it's okay to take, then it would be very difficult for me to tell somebody else to do it. So that's why I did it. And that's why I did it publicly.
Thank you.
You're welcome.
All right. Hello, everybody. My name is Ashton Reed. I'm a senior at Towson University, majoring in healthcare management with a minor in business administration. And for my question, I wanted to ask, does the vaccine protect against the Delta variant?
Well, thank you, Ashton. And you're another one. You're up and coming in our field. So I need your help to get this word out now. Well, the vaccine does protect us against the Delta variant. I do want to tell you a little bit about that Delta variant so you know, because I don't know if you all have noticed, you probably have, that these cases especially due to the Delta variant, has been increasing, especially nationwide in July in particular. It's been a real big factor in why we're having some increases in the numbers. And the reason for that is that Delta variant, unlike the other ones, is about 2 times more contagious than the original strain of COVID. That means it spreads easier, much easier from person to person. And that's why our data is starting to tick up a little bit. Now, things could get worse if people don't get vaccinated. And what you'll see is that in those places where the vaccination rate is not so high, you see that virus is spreading like wildfire. That's why it's so important for everybody to get vaccinated, because vaccination controls the Delta variant spread. We have strong protection against that Delta variant right now by getting vaccinated. Unvaccinated people continue to be at really high risk, and it makes the Delta variant very happy to spread itself from one place to the next. And the Delta variant, like any of the COVID-19, can make a person very, very sick and can even kill them. So unvaccinated people are at high risk, and even higher risk with that Delta variant.
We have like 3 other questions.
My next question is, will the Delta variant or additional variants of COVID ever go away and we will live normal mask-free lives?
Well, it depends. The answer could be yes, if a whole lot more people got vaccinated. So we got work to do. We got some work to do. The key to making sure that we get back to a normal mask-free life is that people get vaccinated. We need a lot of people, almost everybody vaccinated. Now, if more and more people do get vaccinated, the virus has a very, very hard time. And next thing you know, it just can't spread. And if it can't spread, then it goes away. That actually happened with the polio virus, and people got vaccinated to it. And now there hasn't been a case of polio in the United States since 1979. The reason for that, people got vaccinated, the polio virus couldn't spread. So that is how we go about making sure we get back to mask-free, whether it's a variant or not. Now, if people don't get vaccinated, then the variant can start to vary, you can get it to mutate again. You get a new variant and a new variant and a new variant. And then when you get into that situation, it doesn't go away. And so that's why I'm urging, and I want my Victoria, who's a communication major, to tell every living soul that they need to be vaccinated to keep everybody safe.
Thank you.
You're welcome.
Dr. Carter, what's the current numbers of vaccinations done on county residents in Prince George's County? And have we reached herd immunity yet here in the county?
Well, the CDC says we're at about 72% of our residents who are 18 years or older who will have at least one vaccine dose. And we're getting close to almost 70% of the residents who are 12 years and older, because they just approved the vaccine for children from 12 and older. And we've got about 70% of those residents who have had at least one shot. Now, those are great percentages. Those are not herd immunity percentages, though. Those are good, but it's not where we need to be when I say we need to be almost everybody vaccinated. We are not at herd immunity right now. We're inching up there, but we're not close to it right now. That's why you see the numbers tick up, and that's why you see the Delta variant spreading like it's doing. We may never reach herd immunity. And there's a lot of debate about whether or not that'll happen, especially with a lot of people who just refuse to take the vaccine. So it may be that if we get enough people vaccinated, it'll be like the flu, where you have to get a shot every year, and you'll see it'll keep coming up in the fall, winter season, and then go down in the summer. The goal, though, is to get to the point where we eradicate it completely. So if I can get as many people vaccinated and as close as I can to get to 95% or greater, then we could get to the point where we could almost eradicate the virus.
What would you say to people who remain hesitant about taking the vaccine?
Well, I just have to say that, as a doctor, but also as just a person who just loves people. I love them like I love everybody else. We all in this life, we try to work to help each other, make sure each other's safe. And so I don't want them to get sick and die. I mean, that's the bottom line. If they don't get vaccinated, then they can get this virus, and they can get the one that's spreading the Delta virus, and they can get sick and die. I have to prevent that. So they shouldn't really hesitate. This is a safe virus. This is a safe vaccine. The virus is not safe, but the vaccine is very, very safe. When you get the vaccine, you get a sore arm. You may have a few little effects, like you feel like you have a cold, you be tired. That lasts for a couple of days, it goes away. If you get the virus, that it's worse than that. Some people get the virus, they don't feel a thing. But eventually down the road, the virus will come back to them because they haven't been immunized. They may have partial immunity. So if you get vaccinated and you continue, if we need boosters, we continue, you won't ever get to the point where you have to go to the hospital and die. That's what I'm trying to avoid. And it's no reason why a person should think that this vaccine is not safe. This vaccine has been given to millions upon millions of people in the world at this point, and it has not led to any severe poor health. People have been protected. I've been a physician, as I told you, for 40 years. I trust the science. I look at the science. If I think that the science is going to hurt people, I won't promote it. If I think it's going to help, I've got to be out here telling people who are hesitating, get vaccinated. I want them to be safe. I want them to be protected. And, to be honest with you, this is the way we love each other. So we want to be sure that folks don't spread it to other people and keep all of us safe.
Thank you.
Dr. Carter, as a youth development organization, what more can we do to spread the word of protection and get vaccinated?
I want you all to get on every form of media you can think of. Make sure there's a lot of misinformation out there. Make sure you dispel all of that. Just tell the straight line what's going on with the vaccines. Tell how safe it is. You all can actually look up to see how many vaccines have been given in the world. It's probably 1.5 billion doses been given out. Very, 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 very few side effects or adverse effects. This is a safe vaccine. And I know sometimes the young people may not listen to me because I got a gray beard and I'm an old man and whatever. I need from our students to talk to each other to make sure that they get protected. And one thing I'm really concerned about, if we don't get our children protected, our young people, as well as everybody, we don't get up to those numbers, then that virus can mutate and start to affect our younger kids at an even faster rate. And we got to stop that. So it's time for us to tell each other, we got to take the personal responsibility to care for each other and get vaccinated, because that's what we're doing. We can't, one person can't do it alone. We have to do it as a group, as a collective, as a people. And if I don't tell you all that, then it won't happen. So we've got to tell each other, not in a preaching way, but as a matter of fact, this is what we got to do to keep ourselves safe, so that I want the next generation to be there to take over the reins. and you've got some great students right here, some great youth right here, who are asking the right questions. So now they got to go out and tell folks.
Dr. Carter, we really appreciate you taking the time out your busy schedule to meet with us to answer some very important questions. And I'm quite sure it was a gratifying experience for our youth. And we hope to, be able to catch up with you next time with, an update with better news on how the county is doing. Thank you so much.
Thank you, and anytime, just call on me anytime you need me, okay?
Yes, sir. And thanks
Thank you.
to Ernest as well, and Mrs. Williams for your support.
Oh, well, thank you, everyone. You guys did a wonderful job. And I'm really excited that this is going to go out to about 8,000 youth, right?
Right.
To your email distributions. This will be a really great outreach effort. So thank you, Dr. Carter, and everyone on the call.
Thank you.
Thank you, George.
And I thank you all as well, because we can kind of push this out through the health department as well. So I think this is going to be great messaging, and we can kind of enhance our current campaign with some of the messages from your youth.
Yes, we will.
Thank
Working.
you, Delia.
All right.
All right,
I'll
bye
see you
now.
guys.
Bye-bye.
Okay,
Thank you.
Thank you.
Thank you.
Bye.
bye-bye.